Hello everyone, today we are going to simplify something really important for you as nursing students, understanding the signs and symptoms of heart failure, specifically left heart failure and the right heart failure. So these are the key concepts you will encounter often, and knowing them will help you in your nursing practice and also in your NCLEX exam. So let's break it down. Let's start with left heart failure. In the left heart failure, the left side of the heart struggles to pump the blood out of the body. So this leads to blood backing up in the lungs, causing fluid congestion in the lungs. The main signs and symptoms you will see are shortness of breath, since the lungs are filled with fluid, the patients can't breathe properly. Second one is crackles or auscultation. So you will hear these sounds when listening to the lungs through a stethoscope. It's fluid inside the lung. Then we can see coughing and pink frothy sputum. If the congestion is severe, patients may produce these type of sputum. Now let's talk about right heart failure. Here the right side of the heart can't pump blood properly into the lungs for oxygenation. This causes blood to back up into the systemic circulation, which means fluid starts accumulating in the rest of the body. The symptoms you will observe include swelling, edema in the legs, feet, and ankles. You'll see fluid collecting in the lower part of the body due to gravity. And then you can see enlarged liver and spleen, hepatomegaly and splenomegaly. As the fluid buildup, it starts affecting the organs like liver and spleen. And then you can see ascites because the fluid back up in the portal system. And it moves into the peritoneal cavity, so the abdomen become distended, and then we can see jugular vein distension. You'll notice the veins in the necks are swollen because of the increased pressure from fluid buildup. To make it simple, here is a quick recap. Left heart failure is equal to lung congestion, so think shortness of breath, crackles, coughing, and pink frothy sputum. Right heart failure is equal to systemic edema. Think swelling in the legs, liver, spleen, enlargement, and then ascites and jugular vein distension. And thank you everyone, and all the best.